U.S. authorities tonight are urging caution, not alarm, but caution amid these rising COVID cases across Europe and China, driven by the Omicron subvariant. They're now predicting it could become the dominant strain here in the U.S., believing it is at least 30% more transmissible than Omicron was. They say it wasn't too early to take off the masks, but to keep them nearby, and they're not ruling out needing them again. Steve Osunsami at the CDC tonight in Atlanta.
At the same time, most of this country is now dropping COVID restrictions because of declining cases. Health officials tonight are closely watching a new subvariant of Omicron that's spreading overseas.
The cases we're seeing are just the tip of the iceberg.
That coronavirus subvariant is called BA2, and across Europe and China, it's spreading quickly. Dr. Anthony Fauci believes America could see a new wave of these cases this spring.
We expect that over the coming weeks, it likely will be more and more dominant over the BA1.
He says the vaccines work against it, and it doesn't appear to cause more severe disease than the current dominant strain. But scientists believe it's between 30 and 80% more transmissible. BA2 is already nearly a quarter of all COVID cases in the U.S., and at nearly a third of this country's wastewater sampling sites, which have become an early warning system for COVID cases, samples that are positive for the coronavirus are up 1,000% in the last 2 weeks. The director of the CDC says don't throw away that mask just yet.
They should put that mask in a drawer, because if we have more cases that occur in the wintertime, if we have more cases that occur because of a new variant, we want to make sure that people have had the opportunity to take those masks off so that we can re-implement them and protect people should we need them again.
Public health officials are pointing out that immunity from the vaccines and prior infections is getting less every day. Pfizer, for example, is asking the government to approve a fourth shot for Americans 65 and older.
I don't think there's any doubt that sooner or later, particularly among the elderly, that they will need a boost of a fourth shot.
Health officials here at the CDC worry that we could only be a couple weeks away from what they're seeing in Europe right now. And they point out that a new variant of the coronavirus could pop up at any time.